Let's talk about the Joint Commission and the role a Joint Commission plays in reviewing a hospital's performance.
Thank you.
Mr. Hunter.
Good afternoon, Dr. Bork. Good afternoon, Mr. Hunter.
I thought you said you didn't have a report.
I don't know, sir. You're not
listening.
Perhaps I'm not being clear today. I do not have access to the 2018 report.
That sound was Hunter's soul leaving his body.
I thought I buried this Dracula several years ago. But
You have an opinion to a reasonable management probability that the failure of the medical executive committee to address this caused or contributed to the harm of Mike Walski.
Objections beyond scope.
You can answer.
Thank you. I do believe that this failure on the part of the governing body contributed.
And this particular individual happens to also be remarkably charismatic and have phenomenal hair to combine with my, I guess, phenomenal beard.
Et tu, Rob? You're going to jump on the good hair stuff too? Really?
Dude, why not? I mean, I can't keep this thing in order.
Thank you for that. And speaking of looking fabulous, coming to the program right now, Dr. Joe Corcoran, who we have also labeled here as Dr. Good Hair. How are you?
I'm great.
Good evening, advocates, and welcome back. So happy to have you with us tonight. I really think that this is going to be a spectacular evening. Happy to have you along for the ride. And I think that tonight is going to start an education that we've all talked about together in the chats, in the commentary. And we're going to be talking about a lot of different things, but the focus, especially in the latter half of the program, is going to be talking about advocacy. We're going to hear from an expert about, how to be an effective advocate. And then we're going to talk with somebody who probably hasn't spent that much time studying it, but in her first big time on the stage as an advocate, you'd have to say that she nailed it. And so I'm really excited to introduce you to Annie tonight and let her tell her story about being an advocate and what inspired her to do it. So, but I'm super excited about having, I know that we've got many folks over from Megan Fox's channel, and she puts out some wild content. She sometimes she doesn't have much of a filter, and that's one of the things you've got to love about her. But she does put out content every single day, and one of the things that she does is she puts out a podcast that is on Apple Podcasts, Spotify, Amazon, anywhere that you listen to podcasts. I strongly encourage you to listen in to hear what Megan has to say. The name of her podcast is the Fox Den Daily, because she is Megan Fox. So Fox Den Daily is a great source for just hearing what's happening across the LawTube community. I mean, I was in her audience yesterday, hearing about the bachelor faux paternity suit in Arizona. It's just absolutely fascinating. I actually was following along a new to me trial that Scott at Recovery Addict. I know that we've got several members from the gallery have already sneaked in. I see you, but several members from the Recovery Addict gallery are in here, and I know Scott was walking through that unfortunate and tragic death on the set of the movie Rust, where Alex Baldwin inadvertently shot and killed one of the one of the behind the camera stars. Really tragic story, and very compelling testimony at the end of the day. I believe it was from the director or producer, David Halls, if I'm not mistaken. Really brought a tear to my eye. So this is a fascinating corner of YouTube that I had no knowledge of at all until I became involved with the trial and met people after the fact, like Megan, like Scott from Recovery Addict, like Rob from Law and Lumber, like Melanie Little, like Peter from The Lawyer that you know. Here we are. But what makes me excited about tonight is really two things. Number one, we will start our first serious step forward about how do we become more effective as advocates. And to get us started with that, I am really excited that my new friend, Dr. Scott Richards, is joining us. And Scott, you will recognize Scott as soon as you see him, because he was the one that he generated and he delivered maybe the most compelling testimony of the trial. And his testimony, while we won't discuss anything about the testimony specifically tonight, because we're in the middle of we're pre-mediation, we are, waiting on the appeal, the filing for the appeal. And so we don't want to get into the specifics of Scott's testimony, but, there's a very good chance that Scott's testimony and the subsequent ruling by the jury that was entered by endorsed in the judge's order may actually create case law in the state of Florida. So that's a really big deal. And so Scott is just an absolutely brilliant physician, psychiatrist, and has been helped to thousands of patients in his career. And tonight, Scott, this is the very first interview that you've granted since the trial. And my friend, I am so honored that you're doing it here with me and the advocates. Welcome aboard. So happy to have you.
Well, first of all, thank you so much. I'm not sure I deserve the introduction that you gave me tonight, but I thank you.
It was just you wrote.
Oh my gosh. Bear with me. I have new earbuds, as I told Joe, so hopefully they fit in today. Couldn't find the old ones. Yeah, thank you so much. What a privilege it is to be here. Let me start with that. This is a privilege, and people think it's an honor. Honor, privilege. It is a chance for us to be able to be outside our field of medicine and really experience something that can help others other than just seeing patients. So, Joe, I want to thank you immensely. And you're right. We sat next to each other the day you did your testimony, and you kind of looked at me and said, you did a great job. And then after your testimony, I literally was blown away by your testimony, both first and then the second one, and was integral, obviously, to this case that I've been involved in almost 6 years now.
Well, thank you for that compliment. And one of the early comments that was made even before we went live, somebody that we both met in the courtroom, sat next to Jules for much of the trial, Cake Lady, Alicia, the Cake Lady.
Alicia.
She felt that your testimony and my testimony were key to helping Team Maya stick the landing. So I appreciate what you have to say about my testimony, but Scott, honestly, I think you did a phenomenal job. So
thank you. Let me just start off by saying it was a very difficult testimony to prepare for, because they spent so much time trying to keep me out of the courtroom.
Yeah.
And subsequently, I learned, because they didn't have anybody to rebut what I was saying. But also, too, the difficult aspect of that testimony was, how do you present a self-termination of life, a suicide, in a way that a jury is going to be sensitive to it? And I spent a lot of time reading a lot of contemporary work, but also going back and reading Dostoevsky and Camus and Nietzsche and people that talked about personal suicide and academic suicide, to get every perspective I could get on it. And it really
Scott,
made me do a deep dive into it.
Scott, I'm very sorry to interrupt. The S word will get you in trouble on YouTube. So
My apologies. I will use
no worries.
self-termination.
Just be mindful. Yeah. Thanks. Yeah.
But it was one of the more difficult things for me to take on. And I wasn't sure how they were going to come back at me, although I found out, according to Ethan Shapiro, I'm a frat boy who does pseudoscience now. That was wonderful in the closing. I actually almost burst out laughing during the closing when I was sitting in the courtroom.
So sorry.
That was fun to hear. I'm going to use that one in my CV, I think, in the future.
Yeah, for sure. That should get you an academic appointment, right? Yeah, there's lots. When all of this is said and done, I think it would be fascinating to get a number of the people who were kind of, critically involved in the trial itself, and to sit around maybe with some 80 proof beverages to be shared, and to really talk gloves off about the trial. And just a comment about I mean, listen, let's face it, psychiatry is not a new profession, right? So calling it pseudoscience, I'm not really sure how he got there, but
we started as part of neurology. I mean, that's the interesting thing.
Right.
I've said to people, we started off here. By about the 50s, we got as far away as possible with psychoanalysis. And over the last 70 years, we've become part of neurobiology again.
Yeah.
I have colleagues who call themselves neuropharmacologists, psychopharmacologists, neuropsychiatrists. I did a year of neurology during my residency, and I still do a lot of neurology and neuroanatomy, because everything you do, this organ is affected by everything in the body.
For sure. Well, hey, so I know that you and Greg have a long-standing friendship. I know that you competed against one another in Florida. Both of you were, nationally ranked swimmers in high-profile high school swimming programs in the state of Florida. Mm-hmm. And I know that you swam together on the same team at Duke, but I found it interesting to hear you tell me yesterday that your friendship with Greg did not start then. You were competitors back then, but your friendship actually didn't start for several years after, until you were in medical school. And
in college, when I got to Duke, I was recruited by a coach that was there. Greg had been kind of one of our arch rivals in Jacksonville, and I was down in Fort Lauderdale. And we did not like where he swam, and he did not like where I swam. And both of our coaches ended up being Olympic coaches in different years. Yeah. And when I got to Duke, I kind of stayed away from Greg. And our sophomore year, they fired our coach, and I ended up leaving Duke. And I went off
and ironically, Randy Reese, who was Greg's coach in high school, he became the swim coach at Florida. And I had friends on the swim team. So I actually went to the pool, and Randy Reese saw me swimming and thought I was just a hopeless cause. And he actually tried to teach me the basics. And at the end of that hour or so, literally threw in the towel.
Randy,
so you never have to worry about me.
Randy was one of the best coaches that's existed, I think. I swam for Jack Nelson at Pinecrest, and both Greg and I, as we're adults, we've said probably two of the best mentors you could have asked for.
And when one of the best coaches in the world gives up on you, it kind of tells you it's not your sport, right?
Go find something else. I think you're right.
Exactly. But so tell me, I know that you have this long-standing friendship, but when exactly did Greg bring you into the Team Kowalski?
Well, during my residency was when I first actually did some medical review for Greg. He was living in Jacksonville, and I was doing my residency and fellowship in Charleston, South Carolina. He had called me and said, I have this person who had an injury and they have schizophrenia, and I know you're doing your residency. Can you look at the case? And naive person, I said, sure. And so he sent me the records, and I gave him an opinion. And over the next 20 years, I would every 5 years have a call from him. Hey, I've got this person has a medical problem, a kidney disease. You're smart. Can you review it so we can save some money for the client? Sure, let me go ahead and review it. And I would tell them whether they did or didn't need somebody. About 6 years ago, I think I was visiting them in Idaho, and his wife, Jennifer, as I was going up to get Greg to go out and do some skiing or something we were doing, maybe fishing. And she said, "You've got to see this video. We just got this. This is a terrible case." And I saw Maya for the first time when I believe she was being pushed to move and she was screaming and crying. And I said, "Wow, that's horrible." Didn't think much about it. And about 4 months later, Greg gave me the call again and said, "I've got this case and I need you." And I said, "Oh, you need a doctor?" He said, "No, I need you." I said, "You need a psychiatrist?" And he said, "No, I need you." And I said, "What are you talking about?" And he said, "This is mental health. It's a commitment case." And he went through everything. And I said, "Send me the records." And normally I would get about 2 or 3 inches of records from Greg. I'd read through it in an afternoon, call him, give him an opinion. 2 days later, 3.5 feet of medical records showed up at my doorstep via FedEx. And 3 days later, I called him and said, "This is one of the worst things I've ever seen, being a physician and a son of a physician, and having worked in commitment hearings and hospitals and child protective services and adult protective services. I just found actually the 3 questions that I asked back in May of 2018. The question was, who the H is Sally Smith? The second one was, why did they go after Beata and not the doctors? And the third one was, where's the psychiatrist?" And that began a dialogue in 2018. Months later, back in Idaho again, I was working in Pocatello. And so I stopped for a few days to do some fly fishing. And we ended up doing the first affidavit, I believe, in the summer of 2018 that began the lawsuit.
Wow. Wow. So your affidavit was actually the one that was submitted when the case was opened.
Yes, I had to do a couple of others because they changed, as you were mentioning, I believe on Monday with Jules. They called me at one point and said, "We need to do a new one." And so we redid it and we added things and we stopped things. I think we pulled people out. We had to add people in. And not to the degree of Greg, but 5.5 years is a really long time to be getting phone calls from your best friend and having to discuss for hours, not friendship things, but really down and dirty and some deep issues.
And difficult and painful issues.
Very painful and exacerbated by when I got all of Beata's history and some of the things that never came up in court. I felt like I got to know Beata very well. And the pain got worse as I got to know Maya and Jack and Kyle, because I began to see what they lost.
Yeah. You know, it was an easy case to know why you wanted to get involved, but it was a hard case to get involved in because the pain was so real, the loss was so grave.
Palpable. About 3 years ago, coming up now, Greg asked me to roundtable a lot of the experts that he had already obtained at that point, and we had about 12 experts in a Zoom meeting that I ran from my house here. And my first concern was when physicians get involved in a malpractice suit case against an entity or a hospital, most physicians, we kind of don't want to do that. We don't want to eat our own. And so as I started off the meeting by saying, I read this and I said I had to get in, and I went around the table and every physician, researcher, PhD had the same exact response. And it made me feel better as an expert saying, we're doing the right thing here.
Yeah. And you know, we'll discuss it in a little bit, but I never viewed this as a malpractice case. This was a systemic case, not a physician done wrong, amputated the wrong foot, right? This was a system that let a 10, soon to be 11-year-old little girl down. And I think one of the things that was difficult for the jury and even anybody watching the trial is that, you look at Maya as she sat in the courtroom, and she is a young lady who sits up straight and has a stature. She's a tiny little thing, but she plays bigger, right? She has a big charismatic aura to her. But you had to remember that everything that we were talking about was happening to a 10-year-old, a tender age child, right?
It is unconscionable what they did, in my professional opinion and personal opinion.
Yeah. Well, let's not get into testimony. I
Correct.
promised you we were going to stay away from that. So, how you said that you've been involved in other child protection cases. You've done similar type cases, court cases before too.
Hold on a second here. I just, for some reason, I think I hit a button and everything has stopped in my face here. So let's see what I did.
Well, we can still hear you and see you. You're still
Well, then
fully active.
I'll leave it there then. What was the question again, Joe?
So you said as you were talking a couple minutes ago, I believe that you said that you have been involved in child protective services situations and court cases before. Did I hear you right?
Yes, I've done a lot of work with adult protective services during my time out in California. I had a few child protective services. A lot of it were patients coming to me concerned about what was happening in their home, and therefore I had to make the phone call as a mandatory reporter.
Yeah.
And so when you hear things, you have to do certain things. And that's part of what happened in this case here, is that I felt there was some things that were done inappropriately. But I started off by doing some court cases actually during my residency in Charleston. As part of your internship and residency, when you're at the county, you do the commitments. And then if your patient is in the hospital more than 7 days, you have to go to the court case and go on the stand and actually defend your commitment. I think you know that area. And then when I was in the Air Force, I ended up becoming head of the alcohol rehab. So anybody who got a DUI, I had to go into the judge advocates and testify as the expert witness in the Air Force. And anytime there was a violent episode with children in the Air Force, the psychiatrist gets involved. So I had it both in the civilian world and in the military world at the time.
Interesting. And I'd forgotten that you were in the Air Force. Thank you for your service. I appreciate that. My dad was enlisted in the Marines and ended up in naval intelligence. So he stayed closer to the earth than you did.
I'll tell a quick kind of a story. When I was in the Air Force, I was stationed out at March Air Force Base in California. We called it the world's largest gas station because they didn't have any nukes or fighters, but we were just an air refueling wing for the Strategic Air Command. My last 6 months in, I got to do manning assistance in Minot, North Dakota.
Oh.
And I'm a Florida boy who's living in California. When I called Greg Anderson to say, this Florida boy, I don't think I'd ever heard him laugh so hard for so many hours. He still is giving me a hard time 30 some years later about why not. So I'll bet. But that was a unique experience because I was at a nuclear base where we had nuclear weapons, nuclear ordinances on the airplanes, and I got to go in the silos and actually see where the gentlemen were in the silos.
Oh, very cool.
Very. Can't talk a lot about some of the details down there, but as a psychiatrist, I had to go down and do that. Part of the Air Force role, too, as a psychiatrist on that base is you are the designated hostage negotiator. And 2 weeks into it, they had a mock hostage out of the blue, and there I had to go in as a 31-year-old captain and negotiate hostages. And that was a unique experience that I learned trial by fire.
One of the things that I do frequently is I mention books that I love. And if anyone of the advocates is looking for a book on negotiations, and I'm talking about all negotiations, negotiating the purchase of a house or the purchase of a car or negotiating a personal relationship, there is a book called Never Split the Difference. The author is Chris... will come to me. Never Split the Difference. This gentleman, Chris, single syllable, can't think of his name right now, but he was an FBI hostage negotiator. And I will tell you, hands down, it was the best book that I've ever read about negotiating. So interesting.
I will have to look that up. Thank you.
Interesting part of your history. So let me be very, very clear before I ask the question. You were not a treating physician for Maya or anyone in the Kowalski family. Okay, so let's just stipulate you were not a treating physician. But have you ever been a treating physician for families going through such a traumatic loss as the Kowalski's loss of Beata.
Yes. Obviously, for confidentiality, I won't use names, but I've had patients. I do a lot of locum tenens work around the country helping hospitals. I had 2 incidences about 6 years ago where I actually admitted someone who was suicidal because they had their child taken away from them. And sorry about the S word there, that they had negative thoughts about themselves. And then we had a second episode where a person had been accused of it and became very psychotic as part of their illness. And so I actually had to go to court on both of those in Idaho during their commitment hearings and talk to some people. That was unique experiences. I would say probably the doctor that testified for the child psychiatry part of the program, Dr. Brewerton, did a fantastic job. He has probably dealt with this a lot more because he is a child psychiatrist. He's also a forensic psychiatrist, and so he's been involved in that. I got to say it. He was my fellowship director. I was his first fellow ever. I did a research fellowship in eating disorders with him and mood disorders in Charleston. So when I got him on board, he was one of the people. I said, Greg, I'm good, but you need somebody that can tell you everything that's going on with child psychiatry. And I'm so pleased that Tim got involved in it because I think he also gave a fantastic testimony of which they had no rebuttal as well. I just saw Tim a month ago at the South Carolina psychiatric meeting, and he has some interesting stuff coming up about multiple personality and potential movie too. So he's very, very well versed in child psychiatry, and he may be somebody you want to have on in the future as well to discuss some of these advocacy issues. He's a strong advocate for patients.
Well, let me just preview to the advocates. I know from talking with you yesterday, where we kind of wanted to make sure that we knew what was inbounds, what was out of bounds. I have already acknowledged that our time tonight is going to be fairly limited because I have another guest that I want you to meet. And super excited about bringing her and her mom to this group and tell her story. But I have already secured your commitment to come back again, and we'll be able to go a lot deeper and actually take more questions from the audience. I do have I know that I've got a question or two in the super chats. I will get to those tonight, I promise. But right now, I just want to kind of keep going along. I'll get to your questions in the super chat in a few moments. So Scott, you are, as a psychiatrist, really a student of human behavior. And so with your expertise, with your training, I'm really curious, your first day in the gallery, you testified because of an unfortunate circumstance. You were, I believe that you were at a funeral up in the Northeast.
Yep.
And you had to testify via Zoom or Zoom-like remote testimony. So your first day in the gallery was the day that I got called up for the first time as a witness. But I know that you spent a lot of days in the gallery. And so as a student of human behavior, what did you pick up on? What did you see? What did you sense from the jury from time to time during your observations?
Well, that's a good thing to start with the jury. When I did sit in the gallery, actually, I sat on the side of Greg's side most of the time, but I would also go on the side of the defense and sit from their perspective to see what they were seeing. I watched the jury a lot. That was my main focus. Greg had asked me once I had testified to try to do some profiling of the jury, of the defense, of the judge, kind of everybody. But the jury itself was a very fascinating thing to watch. Over the time, I began to see patterns of behavior that on a daily basis, you begin to see people do things on a regular basis. Specifically, I remember one instance where there were some people that always looked at their notes, always looked at the computer screen. And there was one episode, I believe it was I think it was Ethan Shapiro. And it was the first time I saw 3 jurors literally put their pads down and they were not interested in looking at the screen anymore. And I wrote down, they're bored and they're fed up with it. And it was interesting over the next 3 days to see them just not seem as relaxed as they were in the days before.
The jurors were not, or
the jurors. That
okay.
you saw a change in the sitting. You began to see a change in their posture. Interestingly, when Greg would come up to cross-examine somebody, and I believe, I'm trying to remember who it was, people almost sat up in their seat, and it was like they were getting ready for the battle. And it was so, I think Jules was next to me, and I started smirking, and she said, "What's wrong?" And I said, "I really can't say anything." But it was so fascinating to watch them. It was like they were getting ready for the bullfight, and they didn't want to miss when the spears were stuck in the person. And so that to me was something that I knew at that point, Greg's personality had finally come across to them, that they knew who he was.
You know, it was interesting because the first time that I had Greg on this program, I described his style as akin to Peter Falk's fabulous character Columbo. Right, you know, he always seemed so disorganized, and always seemed, you know, what, one more thing, Dr. Richards, one more thing, right? But that guy, Greg Anderson, on cross-examination, he was a sniper.
Yes.
I sleep better at night knowing that I will never have to be cross-examined by Greg Anderson. Holy moly.
I will say that I have known him for a long time. He prepared intensely for this trial. And I think that may be one of the biggest differences. I really see that he approached this trial like he was training for the Olympic final. He immersed himself almost 24/7. Sometimes I had to tell him, "Sleep and eat, please." I would call him up and say, "You look tired, please eat." But I think he took this so deeply into his soul that it became part of him, for better or worse sometimes. But obviously the result was fantastic. But I really think that because he knew the material without having to look at some things, when he heard something, it was that sense of, oh my gosh. I say I speak in a lot of metaphors because English is a lousy language. We're not great in terms of how we communicate. I had the idea, because I'm a fisherman, I said it was like all of a sudden he saw fish jumping over there, and he said, "Wait a minute, I got a cast over there now." And that was fantastic to see. I've got to say that he prepared so intently and worked his ass off.
Yeah. Well, and you know, in talking with Greg, you know, he felt so compelled by the tragic injury that this family was subjected to. You know, this was not chasing an ambulance, right?
Mm-hmm.
This was a case that he and the firm took on because it was the right thing to do. There were not a lot of people interested in the Kowalski's story, but Greg and Jennifer and Nick and others in the firm heard it. And as he has told to me, there was no hesitation because it was the right thing to do. You know, it was certainly a long shot of a case, but you're right. They all worked their tails off.
I can remember Jennifer and Greg both independently saying, "I can't imagine having this happen to our children. I don't want to have it happen to anyone's child ever again." And they kept that stance, and God bless the both of them. They were angels for the Kowalskis with their work.
They're such amazing people. So you talked about what you saw in the jury, and you kind of hinted at something that you saw in Mr. Shapiro, but did you pick up on anything from the legal team as you were moving from side to side and getting different perspectives?
Absolutely. You know, the days that I sat behind the defense, first of all, I think it unsettled them because they knew me from multiple depositions. I had my own couple of depositions, and then I sat in on a couple of Sally Smith depositions, which were quite interesting. And so they knew me prior to this. I made a point of not being seen before my testimony, but once I did the testimony, I was in there. The first day that I went over on their side and sat right behind their electronics guy, I must have gotten 10 or 15 looks during the trial that day. It was like, what are you doing on our, it was almost like, what are you doing on our side of the wedding? But the perspective of the courtroom from their side was very different from where Greg and his team were sitting.
How so?
They were next to the bailiffs. They were next to the wall. They didn't have really anything on that side. The jury was a good 20 to 35 feet away. And
Yeah.
Greg's team was literally within, at some times, I think Maya and Jack were no more than 6 feet from juror number 6.
Yeah.
And so that was a very different dynamic. I think because of that and the way the jury was sitting, it was easier for them to see Maya. I do think if they had been at opposite sides, it would have been a very different dynamic because they would have had to look over the defense to see Maya. But because Maya and Jack were right there, you could, as you mentioned, Maya's aura, her personality. She wouldn't fidget. She sat in her chair, stoic and adult-like. And I think that that really went a long way.
For sure.
I saw in the jury, they were empathetic to people that were honest. I did see many times that when, I think Megan Fox called it the Beatty bunch or the Beatty bunch, when the different nurses, or I call the Johns Hopkins cheering team that would come on and their witnesses, you could see almost a change in their posture. They were, it was uncomfortable for them to hear these people talking about how fantastic Johns Hopkins was.
Yeah.
And being there, the defense team doesn't have time to do this, and so I really am glad that I was able to offer that to the team Maya. I very many times wasn't even watching the witnesses. I was watching the jury. I was watching the defense team, and then of course I watched good old Judge Carroll, who was quite interesting during the trial. And we'll talk a little bit about him, but I don't want to do too much with Judge Carroll.
I thought Judge Carroll did a phenomenal job.
I think he did a fantastic job.
His judicial temperament, I thought, was top shelf.
The calmness and the thought he would put in before things he would say struck me very quickly, especially in the courtroom.
Yeah.
He was not going to say something out of emotions, out of frustration, or out of turn. He waited and then said his piece, except for the day that he got angry at Howard.
Yeah.
That's the one day you could see the neck veins were out on Judge Carroll.
Don't look at me that way, Mr. Hunter. That day? Yeah.
Exactly.
Oh my goodness. You know, and I really admired him. There was one day where he took not one, but 2 5-minute breaks.
Yes, that was the day I'm talking about.
Whew. That was impressive self-control. And again, you know, they always talk about a judge's judicial temperament. And I thought he was off the charts, 10 stars.
I had to wonder if his office was soundproofed and if he went there to do some primal screaming, kind of comically, but because you could tell that he was ready to lose control at one point with some of those comments. And he came back. When he came back out, it was obvious he had taken care of it.
Right.
And came back, and he was good old Judge Carroll at that point.
Yeah.
I will say one general thing is I saw Judge Carroll's demeanor towards Greg, especially, change at about week number 4. And that before that, I felt that there was an aggressiveness that was maybe unconscious in some ways, but a sense of being very straight and curt and no softness around dealing with it. And I believe that once, and it may have to do with one of the tragedies Greg had in his family during that, I saw the judge be a little softer towards Greg. It was easy to be soft to Nick because Nick had such a different persona. I'd never seen Nick in action. I'd seen Greg in action before, but I complimented Nick so many times when I would go back to their war house when I was in town and just said to him, Nick, you did a fantastic job. Just so impressed with the changes they had. And I think that was a great thing for Greg's team, is that you had different attorneys with 2 very different personalities, whereas the defense team had 3 to 4 personalities, and none of them had soft edges. They were all hard, rough, rigid, prickly. And that's part of this case, because it wasn't really a malpractice case. It was a humanity case, that if you didn't show that humanity, I'm not sure you're going to get sympathy from the jury on that.
Agreed. Well, great insight. So let me ask you a question, and I don't know if you're prepared for this or not.
I've got a lot of notes that I pulled out from the trial that I hadn't looked at in months. So,
well, this is pure speculation on your point, because there's no way you can know the answer. Do you think anybody, including Judge Carroll, including anybody from the from the hospital's attorneys. Do you think any of them watched the Netflix documentary?
Wow, that is a really fascinating question. Based on the behavior you saw, and as a psychiatrist, that's one of the first things you look at is what is the behavior. I'm thinking they may have skimmed it, but could not tolerate watching the whole thing. So my answer would be, I don't believe so. I don't believe Judge Carroll watched it.
Yeah.
With his demeanor and the fact that, especially some of the writings that he did and the way he would write his and say his opinions, he did them so independently. I don't believe that there was a possibility that he had seen the Netflix.
Yeah.
In terms of the defense, if they didn't, I think they made a mistake.
I would agree.
I think I said to you yesterday, I was surprised that the defense didn't have someone like me in the courtroom every single day, doing jury profiles, doing profiles of Greg and of Nick and his team. That was surprising to me. I made a comment to Greg in a text a few months ago that, it's a good thing they didn't have me because I had been really tough. I would have asked the defense team to do a lot of very interesting questions, and I would have asked them to push Greg a little bit differently.
Yeah.
I felt that they didn't work the research. Well, I'm talking to the choir on this one. Of course, they didn't do their research. You brought up things they didn't know about. And I think they were surprised sometimes with opinions that were made that they weren't prepared to defend.
There were several surprises for me in the trial. And I know that you just said that one of the surprises was that they didn't have somebody like you there every day, let alone somebody to refute your position, right? There was somebody in the comments, and I apologize to whoever posted it. I didn't capture the name, but it said that there were 3 psychiatrists that were part of the plaintiff's case and none representing the hospital. And I know that was a surprise to you, but was that the biggest surprise about you, how they approached the case?
I think a couple of surprises were very big. That was a very big surprise that they had no rebuttal to Dr. Brewerton as a psychiatrist who was an expert, and they had no rebuttal to me as an expert. That in terms of the content, I think the biggest surprise that I had overall is I felt like they were trying 2 very different cases. That Greg was trying a case about terrible events that went on, that were wrong, that were done wrong, the systemic issues, and they were defending their policies. They were defending, we didn't do anything wrong. And there were 2 trials going on. And the famous phrase, obviously, they just don't get it. They never did, and they still don't today. The fact that they're still doubling down and saying, we were right, there's still Munchausen's by proxy, Maya doesn't have this illness. That was also surprising when the expert from Stanford came on and in front of Maya basically said, she doesn't have this. Right. That was the first time I saw Maya get up, and she walked out of there and said, I'm not going to sit and listen to this. And God bless Maya for doing that. But that expert witness surprised me a lot. That he came out and was not prepared, I think. That he was the one person that surprised me. He didn't look professional on the day as well. He did not dress in a professional way. So now that you're saying this, I just realized my biggest surprise, and I said it to Greg and Nick, their expert witnesses did not dress professionally. They did not present professionally. They seemed to be not there. They were there against their will. Whereas every single witness Greg had was there, and they wanted to be there, and they wanted to talk about this, and they wanted to be part of the team. And that's what I got in our roundtable 3 years ago, that every expert was committed and dedicated to making sure justice happened, and hopefully this never happens again.
I thought it was interesting that Mr. Hunter asked me not once, but on 2 separate days about what I was being paid to be there. And I told him in my deposition 2 months before the trial began, because I jumped in late. I never even heard about the Kowalski family or their trial, their tragedies until late February, early March. And so I didn't have 5 years of history like you did, but in the deposition, he asked what I was being paid, and I told him that I was doing it pro bono. And I was surprised that he brought that up not only on the Wednesday of my first testimony, but I think I came back the following Monday for the second. And that's not necessarily something that helped his case. I mean, I think he was trying to paint me as a typical, shill. But to your point, there were so many, yourself included, who were not there for a payday. They were there because it was the right thing to do. And you were helping this law firm that was David fighting Goliath. I mean, Hill Ward Henderson, it's hard to argue whether there is a more respected law firm on the west coast of Florida. And they have resources on top of resources. And here's, Greg and Nick, and their firm is tiny by comparison. It truly was a David versus Goliath. But you're right. I mean, the motivation for many of us to be there was not just a payday.
It's that was one of my biggest surprises. I felt their witnesses weren't prepared. They didn't come across professional. And more importantly, for the jury, if I could sense that, the unconscious picks up things, and the jury would sense that the experts that they had did not want to be there. I felt a lot of the people who were Hopkins employees, because it sounded so similar, they were there because they didn't want to lose their jobs. And I hate to say that overtly, but that's the way that I took it. If I was sitting in a room, I would have asked them, are you worried about losing your job if you don't testify and say what you need to say? If Hopkins had shown a little bit of contrition and said, yeah, this was, we had something to do with it, this lawsuit may have never happened. But they put their feet in quicksand and quickly went down the hole.
Well, as the interim CEO, when he came down from Baltimore and they prepared those board notes, the board talking points that I think it was Nick asked me about, one of them was speak up at your own peril. It was an atmosphere, a culture of retaliation and retribution. So your theory holds water. I do want to get to a question that AKA the Cat Lady asked, and thank you for your super chat. What did Dr. Richards think when he heard Beata was accused of Munchausen's by proxy?
Thank you for the question. My first response when I saw the term Munchausen's by proxy in the chart, I called Greg and said, you can't diagnose Maya with Munchausen's by proxy. In DSM-5, that is a diagnosis of an adult. And my first question was, who examined her? What data had been found? So I was shocked that in an emergency room, within 24 hours, someone can make that claim.
Yeah,
that was unconscionable to me. The fact that, and I think I said this to you yesterday, I told Greg initially, I don't have any problem with the first 24 to 72 hours. When you're in an emergency situation, you err on the side of safety.
Yeah.
After 72 hours, when they had spoken to the primary care, when they had spoken to Dr. Kirkpatrick and Dr. Hanna and other providers, I have never in my career ignored an outside provider's opinion because they have history, they have time.
Right.
As you know, most of medical treatment is not right there. We do something. You have to get a diagnosis based on time. You have to find out what was the person like when they were stable, and did they have this, the limp when they were stable? Well, gee, then it's not a limp due to getting hit. So you need to look at that precursor, and the fact that they were ignored. I think the answer, the short answer is when I read Sally Smith's note, the long thing that she submitted, the first one saying she has to stay in the hospital. And I tried to find out where her psychiatric training was and how she could make this diagnosis without ever having evaluated Beata Kowalski. She saw her for maybe 5 or 10 minutes in the ICU. That was unconscionable to me, to make a diagnosis. They never evaluated her. They didn't look at her history. They didn't get past behavior. One of the aspects you do when you see this as a potential is you have to get a lot of data from cohorts, family, friends, because it's a hard illness to hide.
Yeah. And it's interesting because, when I was clinically active as an obstetrician covering the labor and delivery unit, it was not uncommon. In fact, it frequently happened on at least a daily basis when you were there, that you would be asked to evaluate a pregnant patient who I lived in a beach town. We had a lot of tourists, a lot of women that received their prenatal care elsewhere would have an issue while they were on vacation. They'd come into labor and delivery. I would be on call, and I always described it this way, Scott. I said, I'm only getting a snapshot of a very detailed movie. And so the best thing that I could do was reach out to their treating physician in South Carolina, in Chicago, wherever, and if I couldn't see the movie, I could at least find out what it was about, right?
What a great analogy. Perfect. So that's, in a sense, to me, the ability to diagnose somebody without an evaluation.
Yeah.
I think the second thing that shocked me in this case was that Maya Kowalski was in the hospital for 90 some days and saw a psychiatrist once. Yet the primary diagnosis was a psychiatric illness. And the one psychiatrist that saw her said, I don't know anything about Munchausen's. I'm going to defer it to Sally Smith. So it was this circular reasoning going on.
Yeah.
They didn't allow the outpatient people to come in. I have treated thousands of patients in a hospital. And if a treating provider says, I'd like to come in and see my patient, I do whatever I can to get the hospital, bring that person in.
Yeah.
They're going to be a better patient if you know that you're on their team. And the hospital did the exact opposite in this.
It's
they
interesting.
Stonewalled every provider.
Scott, I'm sure that you heard the same thing that I heard when I was in medical school. And like me, you were probably humble enough to follow it. But, two things. If you listen to the patient, they'll tell you what's wrong. And if you want to know what to do, ask the nurse.
Yeah, I'll take it one step further. My father was an orthopedic surgeon, as I said to you. He passed away a few years ago, but he practiced for 50, 60 years, was a Battle of the Bulge veteran.
And let me just ask, where did he go to medical school?
He went to Temple University.
Yes.
And I went to Temple University. My nephew also. My brother's son is at Temple University Medical. So we had 3 generations. I'll tell you, Joe, the neatest thing about Temple University is when my nephew graduated, my father and I were on stage and we gave my nephew his diploma. That was a very special day. The day I pulled out of medical school.
Excuse me. Supposedly, I am going to get to hood my niece when she graduates from University of Miami in May.
That is awesome.
I
great
can't
experience.
Wait. Yeah. I actually gave her my scissors from my anatomy lab. I still have them all these years later.
Oh my gosh.
Yeah.
Oh my gosh.
Yeah.
Well, the day I left, my father, as I was in my car pulling out for Philadelphia, he looked at me and he said, son, remember, doctors don't run the hospital. The nurses, the security guards, and the orderlies run the hospital.
and at Temple, it was the security guards. And then
so my father knew everyone's name at North Shore Hospital. He knew every security guard, every orderly. And I tried to do the same thing through my career. If you treat people kindly, the day that you need their help, they will treat you kindly.
Yeah. Yeah. Great sentiment. And could not be more true. And before we move on, I do want to thank my amazing moderator, Gothic Brina, for gifting 5 memberships, and LA also gifting 5 memberships. Those gifted memberships mean so much to members of the audience. And Angel Nikki, thank you for becoming a YouTube member. And I hope that you are hitting the like button while you're here. So thank you very much for that. So this is an interesting question. It's come up before. Purple Prose asks, are there laws, etc., regarding social workers giving orders to doctors and nurses? And that might be more of a rhetorical question, but
I'm just trying to imagine in my mind a social worker giving me an order in a psychiatric hospital or any medical center. I don't think it would go over too well.
Yeah.
But I will say, in what I do, I depend on my team. And so in psychiatry, every morning you do a morning meeting where you have everyone on the team in the room for 30 minutes. And so everyone gives their opinion. I used to say to my nurses and my social workers and staff, you are my eyes and ears when I'm not here. So I need to know what you hear. And if you hear something, let me know, because I think if you can leave your ego at the door when you walk in the hospital, you're a much better physician.
Amen. Amen. Scott, let me ask you one last question about the trial, and you started to tease the answer earlier. Being respectful, and any insights about Judge Carroll?
I found him a very thoughtful man, first of all. And that to me was very impressive. He did not act on behavior. The old phrase, at the end of the day, it's what you do, not what you say, and what you learn along the way. I got that from a band out in California, the first part. But he would do things and not say them. He would get control of the room. I have a goal because I'd like to do a book at some point about the personalities that were in this case. I'd love to interview him at some point and just find out his thought process along with some of the jurors. And I would love to interview Howard or Ethan, although I'm not sure they'd let me in the same room with them at this point. I don't think they like you or they like me either, because two of us were very instrumental, obviously, in the verdict. What I found at the end, which I really liked, as he began to have some self-deprecating humor about himself. And that's when I began to notice that he made, I think where I was it either afterwards, he made a comment about his hair there, about his son. And I thought that was hilarious.
What Megan called the tuft of justice.
But I think my perspective would be, he's a very self-aware man.
Yeah.
And in today's world, that's not very common. Yeah. So I took apart his behavior and said, he seems to know who he is. He seems to know what he's good at. But I also found that he seemed to know what he wasn't good at. And that's when he would write the long opinions.
Yeah.
To make sure, hey, I'm not an expert, but I'm going to go research. And that's the final point was, I was so impressed that he didn't just rule. He ruled and then would explain why he ruled.
Yeah.
And I found that very helpful for both sides, hopefully.
I love learning from people, right? And you know, the old saying that if you're the smartest guy in the room, you're in the wrong room. You know, and I learned a lot from listening to your testimony, from watching Judge Carroll, how he handled some very, very, used the word prickly before, and it's a great adjective, how he handled some very prickly situations. You know, I was very impressed with him. As I said, they always talk about judicial temperament being the hardest part for a judge to nail, but it's one of the de minimis qualifiers that gets you, on a higher court, including the Supremes. And I'm not saying he's going to be a Supreme Court justice, but I think that guy's got a heck of a future in a black robe.
I think so too.
Yeah.
One final point, and you asked about the looking at the room. I was also very aware of who was coming in on different days, and I wanted to find out who was watching. And I think I said to you yesterday, the day that the closings, I knew that Mr. Shapiro had a lot of his family in the courtroom. And that was a very interesting dynamic, because as a physician, as I still do a lot of performing and both swimming and other things, when you have friends and family in the room, you are much more nervous than if you don't know anybody in the room. And I'm not sure I would have had family and friends for my closing in there. I would have kept those external emotions out. To have your family, your children, your parents in the room, and then you got if I can say it, he got his ass kicked. And he lost, as you said the other night, 44-0. It was a shutout. And I just can't imagine the dinner table the next few days of looking at, your son, your father, your husband, and that's the image. And the wound he had to deal with, I think, was very difficult.
And if you remember, he wasn't sitting around his dinner table. They were going on a family cruise.
Yes. So this, instead of going on a cruise, you had to experience that. I don't envy the emotions that he and his family had to go through. That must have been a very difficult time. And
agreed.
I think it's easier for the attorneys to see each other as evil, and I try to look at everybody as a human being and try to empathize, to be able to understand what they were going through. I also noticed that Howard had a lot of pain. That was one thing that was very interesting to me, was he had a hard time even standing up and sitting down.
Yeah. And I, as a chronic back pain patient, I actually talked with him about the belt that he was wearing, and I would ask him, he had a job to do, I had a job to do, right? And there was no animosity until he made fun of Florida football as I was exiting the courtroom one day after the third appearance. But I really felt empathy for him because it was difficult for him to be mobile and standing up. He had to stand up to object, and I may be off on the count, but Scott at Recovery Act actually had an objection counter running on his website as he was streaming the case. And if I'm not mistaken, they objected to my testimony 82 times, and that's 82 times that Howard had to stand up to make that objection. Yeah,
that's actually a lot of time to stand up and sit down for, even if you don't have a bad back.
Right. So Scott, I'd like to pivot and again kind of tap into, and by the way, I do want to say thanks to Nancy D. You always are so kind when you jump into the super chats. Thank you so much. But the world needs more doctors like both of you. Thank you for your empathy. And Nancy, I will tell you, the gentleman that I'm speaking with, I described him early on in our friendship as having a deep compassion, and I think you've heard that over and over and over in this conversation, a deep compassion for the human spirit. And but thank you very much for your compliment.
Thank you for the compliment very much.
Yeah, you bet. So let me pivot, if I may, Scott. A big focus of our community, and as I've told you, one of the first things that I decided and announced, even before I really had any content on the channel, was it might have been on Megan's show, and I know Megan is in the audience. Thank you for joining, and also juror 17 is here, by the way. So the juror known as Mr. Clean is in the house.
My apologies. And I was responsible for the nicknames. I apologize for you being called Mr. Clean.
And Jules, I think that
Jules saw it on my paper one day, and I said, "Oh, please don't say that."
And I think that Paul, juror number 1, was here too. I just wanted to, but one of the first things that I decided about this channel, even before I knew what it was going to be about, was I knew that I was going to refer to the audience members as advocates. Mm-hmm. And because, we live in a society where it's easy to be the victim. And one of the things that I'm hoping to do with this channel, Scott, is to help anyone who tunes in hone their skill to advocate for themselves, for their loved ones, for their neighbors, and even strangers that just need their help. When I grew up in Washington, D.C., later in Florida, I lived near an extended family. I had cousins that were nearby. And when a sibling would get married, they lived in the neighborhood or in the community, right? So we were always there for one another. Now everyone is scattered across the country and around the world. So we've lost a lot of that connectedness. I'm one of 7 kids. We're not having gigantic families anymore, right? So we have to be able to advocate for ourselves and for one another. And I always try to finish the show with the same thing: take care of yourself so that you can take care of others. Again, tapping into your perspective as a psychiatrist, as a student of human behavior. Would you share with all of us your expert insight into what skills, what characteristics do you ideally have, or can you ideally exercise or develop to become the most effective advocate you can be?
Obviously a very complicated question, but we talked about it last evening, and to really bring it down to some bullet points is is good and difficult. I think the first thing before I even go into what we can do and how we can be advocates is advocacy means you're taking care of yourself, and it usually means there's a conflict on the other side. Because if there's not a conflict, you don't have to advocate because you're getting your needs met. And advocacy really means I have something that I need to have done, and I've got to make sure that I get a team behind me or myself. So that with that, the idea is finding out what you don't want. And I said to you earlier, I have a term that I use in my practice. I would tell patients, before we can figure out what you want to grow in your garden, we got to figure out what weeds you want to take out. So you got to find out what you don't want. And many people just focus, I want something there. And then someone will come around and say, well, would you want something else? And your focus is taken away. So if you can begin to do some emotional gardening and emotional weeding to figure out what it is you don't want first. I don't want to have surgery. I don't want to be taking meds. I don't want to be, in the hospital this week. So what are the ways I can not do that? And I think the first aspect then is finding out what you want, but really finding out what you don't want. Adolescence is that. An adolescent doesn't know who they want to be. So every day they'll come down with one outfit one day and they're going to be called silly. And the next day they come out looking very differently because they're finding out who they don't want to be first. And it's usually because of the reactions of the world outside them. I'll put my glasses on because I can't read my notes without them. That means time is going on. I think one of the aspects too is that you need to be able to speak the language that the person you're advocating against. And if you're speaking in one language of metaphors, similes, because in English, we say, I feel like crap, and I look at my dog's poop and I have no idea how poop feels. Or I'm so sorry I was hit by a Mack truck. I've been in medicine my entire life, and I've never met a human being who survived being hit by a Mack truck. So we have metaphors and analogies that kind of express how we do. And if you can begin to express yourself in a really good way, it's more likely that someone's going to hear what you're going to be saying. Mm-hmm. So if your language doesn't work, find out what language they're speaking. If the person is a fisherman, use a fishing analogy. If they're a dancer, use a dancing analogy, something that they can relate to. And once you're in their language, you now have a dialogue. Because we're really talking about conflict resolution. That's what advocacy is. I want to resolve a conflict to the best of my ability. And I mentioned you got to listen to your internal dialogue. The one person that you never, ever get away from your entire life is you. That dialogue is always in your head. It's there when you go to bed at night, and it's there when you wake up in the morning, and in your dreams, it comes into your dreams, and you'll see it in different places. So you really need to be aware that if something is not feeling right and you're being pushed to do something, listen to that internal dialogue. Listen to your own meter inside. I think that's really important before you even begin to interact with the person. The other thing that I'm going to really stress is you got to know what your goal is. Many people tend to be doing the avoidance part. Well, I don't want that. But along with knowing what you don't want, you need to have the intended goal in mind. Otherwise, you're a boat with nobody steering. It's just out in the ocean, just moving around. And if you say, I'm heading that way, if you look at that, I'm going that way, but there are 3 barriers in front of me, you then begin to get a plan of how you get there.
Right.
I think the final thing, and we talked about our guest coming on later on a little bit yesterday, but we also talked about Maya. Stay focused. The one aspect that people don't get their needs met is they get sidetracked. And in today's world with cell phones and computers and interpersonal actions being so quick, people get defocused very quickly. So the idea of write it down before you go somewhere. Remind yourself, have things that keep you on the track. This applies not just to being advocacy, but I think it applies to life in general, that if you keep your focus, you're more likely to feel better, less anxious, less overwhelmed. I think if you know what somebody else's language is, you're less anxious, you're less overwhelmed. The final point is listen to your anxiety meter. If you're starting to become anxious and emotional, 99% of the times you will make a bad decision.
Yeah.
We always say, listen to your heart. I say no. Listen to your heart, process it through your brain, and then make a good logical decision.
Yeah.
Because
Yeah.
if you're out in Michigan in the middle of winter and you see a beautiful lake and say, I want to go swimming, your heart says, jump in the pool.
Yeah.
Your body is going to say, we're going to die of hypothermia. So you need to be very aware of this
Balance.
wonderful processing
Yeah.
unit that we have above our shoulders.
Yeah. And I will tell you from a practical standpoint, number one, let me point out the name of the book that I was referencing earlier about negotiation is Never Split the Difference. The author's name is Christopher Voss, V as in victory, O-S-S as in Sally Smith. Okay. But Chris Voss's book really centers around a lot of what you just talked about. And one of the things that I really appreciate what you said is know where you want to go. I don't want that. I don't want that. But here's where I would like us to agree we're going to go. And you'll hear that in a couple of minutes when we bring Annie on, how she did that. I am a note taker. I had meningitis years ago and kind of scrambled a lot of the way that my brain processed information for a number of years. And I became a list maker and a note taker. And so, there's nothing wrong with making notes to keep you on track as you're going through particularly a stressful environment, like speaking uphill to someone who has a knowledge advantage or a status advantage. And you frequently find yourself in that environment in the healthcare system.
Especially the healthcare system. I tell people when you walk into a medical office, you're not at your best. You're not at your best physically, and you're definitely not at your best emotionally. In an emergency room and doing psychiatric emergencies, it's even more so. People are on their absolutely worst behavior when they're put in the hospital against their will for psychiatry. And I've always said to the nurses, do never expect the first 24 hours to be what it looks like the second 24 hours. Because the first 24 hours, the person has lost total control of their life. And that's what happened in this case is every bit of control was taken away from Maya, Jack, Beata, Kyle, and nobody ever gave it back to them ever. The goal of hospitals is you bring them in and take control away so they're stable, and then you gradually give control back to your patient, whether it's diabetes, hypertension, kidney disease, lungs, mental health, no matter what it is. First, we have them on an insulin drip, and then gradually we get them to get their own insulin, and then hopefully they're more in control. So I think that's one of the aspects that I see in medicine today is physicians are just going down the little checklist, and they're just telling the patients what to do versus having a person in the room that's actually working with the patient, and they're in control. I've always said to patients, it's your treatment, not mine. I'm the person that's helping you get there.
Yeah, agreed. Well, I'm going to introduce you to a fascinating young woman and her incredible and supportive mom. I want to introduce you to, and I see a camera going sideways. The young lady with the glasses on your left is Annie, and her mom is Denisia.
Camera looks great. Okay.
Can you guys hear us? Annie and Denisia, can you hear us?
Hi, can you hear us?
Yes, we can.
Yay! Yes, we can. Can you see us, hear us?
Yes, we can. Yes. Thank you. Thanks for joining us.
There we are. Everything went wrong.
Understood. Well, so Scott, I had the opportunity to meet Denisia several months ago, right after I launched this channel. And she told me a challenge that her daughter, Annie, who's on with you now, was going through, and how Annie, through listening to a program that her mom was watching on YouTube, found the courage to advocate for herself. So I've been looking for the right opportunity to bring them on, and I thought today was the day. So looks like we lost their camera, but Annie, Denisia, can you still hear us?
Uh-oh.
We'll wait till they come back. It's a really fascinating story. So let me give you a little bit of background. Annie, as I previewed the program before. She is a now 15-year-old. She was 14 when I first met her mom a couple of months ago. She was diagnosed with scoliosis. And again, scoliosis is a curvature of the spine, an abnormal curvature of the spine. Normally, as you know, Dr. Richards, the spine will curve front to back. So if I turn to my side, there's an S shape to the spine. This is an actual X-ray of Annie's spine. And you can see here is her chin. This is her esophagus, her swallowing tube that leads to the stomach. And it is overlying her upper or cervical and upper thoracic spine. Gets into the mid-thoracic spine, and it makes this really sharp deviation toward her right hip. Then makes a magical curve back toward her left hip before reaching center again. And, you know, that deformity of her spine is going to be a lifelong problem for her. But, you know, being 14, 15 years old, she and her mom, Denisia, who live in the Northeast, they decided that they wanted to at least explore what options they had to have it surgically repaired. They live in the Northeast, and I'm emphasizing that because they have options there, right? They don't live in flyover country where there's only one major medical center in 100 miles. Within 2 hours drive time of their home, they can be in 2 or 3 or more major academic medical centers. So they had gone to see a specialist who actually came to a local clinic where they live. And this specialist came from a very highly regarded academic medical center, and had recommended a very aggressive surgery, a spinal fusion, which was going to require Annie to be out of school. She would spend a week in the hospital, about 6 weeks out of school, and getting mom to assist her with all of her ADLs, activities of daily living. So she would need her mom to help her to go to the toilet. She would need her mom to help get her in and out of the bathtub and to eat her breakfast and lunch and dinner. And she was really going to be very dependent on her mom, not what most 15-year-olds want to do. Then she would have her regular schooling disrupted by probably 4 or more months. She would only be going to class half time. She would only go a couple days out of each week. And so this surgery that was being proposed scared Annie. And she's a smart young lady. And she did her research, and she found out that there were less invasive alternatives, and she wanted to explore them. And when she brought them up to the surgeon, who again came from an esteemed center and was fellowship trained, and she really knew her stuff, she dismissed this 14-year-old girl sitting in front of her and made statements. And Scott, you've heard it a million times among our colleagues. Well, because I'm the best, because I said that's what we're going to do, right? It was very much, listen to me, I've got this, right?
Authoritarian
for sure. So Annie again did her research and stood up to her. And so her mom, Denisia, had reached out to me and said, well, you know, we live in a smaller town. What do we do? And I said, this is a big deal. It's worth spending an hour or two in the car. And I gave her some recommendations. I gave her about a half dozen places within a 2-hour drive of her home where they had big time spine programs. And so they went to one. And when the residents and fellows were working up Annie, you know, they were, well, yeah, we're going to do the fusion. That's what we've got to do, blah, blah, blah. And when the chair of the department came in to kind of spend that 3 minutes and sprinkle holy water on what the fellows had decided, Annie stood up in a big way. And she said, I'm not comfortable with this, right? And she did it in a respectful way. Oh, let's see if she's back. Annie, how are you? Can you hear us? She's back. Okay, Annie, I have
a little
told
bit. It
you.
sounds a little.
Well, you sound great to us. Make sure you're watching on. Make sure you're watching on StreamYard, not on YouTube. Okay. Because there's about a 7. There's a 7. You can't.
We can have.
Can you not hear me, Annie?
Tell her. Send that. Say it is.
It doesn't look like she can
Very
hear
choppy.
us. Sure. Why don't Sally? Is there a way that that they can do a phone call? I don't know how to make that happen. So let me continue the story, and hopefully we can get the sound parts figured out. So she worked with the chief of surgery, and they explored doing an alternative case, an alternative type of surgery that's called a tether. And it's much less invasive. It's done through small incisions, not a big zipper down the spine. And you know what? She has not had any work done yet. It's likely that she may have already started to fuse her growth plates, and she may not be a candidate. But you know what, Scott? I was so impressed that she stood up for herself. And really, that's what Denisia was. Denisia contacted me to say, you know, I never saw my daughter like this. And on the drive home from the hospital the first time, Denisia said, where did that come from? And she said, well, Mom, you started watching that program and all they do is talk about advocating for yourself. And I decided I was going to advocate for myself. Annie, can you hear us now? Can you hear us?
It's very choppy.
Tell him
okay.
Tell him he can call in.
Can you call us? I think that'd be better.
And then we can just do speakerphone.
And then we could do speaker if that works.
Yeah, I'll try. Let's see if we can figure that out.
Okay.
I won't offer assistance. I'm not good at these things.
Understood. I'll be back in 10 seconds, Scott, okay?
And then when it calls, you're probably going to have to turn the volume down on that.
Mm-hmm.
Denisia, can you put into the private chat your home phone number? Or whatever number you want me to call.
What is he? Private chat the what?
Phone.
Yeah, use the number, Annie. Put it in.
Put it in the private chat. Got it.
And then turn. Okay. Did you get the phone in?
Mm-hmm.
Let's see if this works. This is where we play the Jeopardy music, right, Scott?
I'm getting some text, Joe. I have some friends that are currently watching.
Yeah, we could actually. Can you leave on we could hear you on the program. I can only hear you on the phone right now. So if you can leave whatever you had on, that would be helpful. And I'll ask you the questions through here. The audience will be able to hear it, and we'll be able to hear your reply. Okay?
Ready to go.
Well, let's try this instead. So,
Okay.
all right. Sally, would you just let me know if you can hear, if we can hear Annie and Denisia on the, great. I'm getting great and good. That's awesome. Okay.
Yay.
All right. Hey. So Annie, I was telling your story to Scott and to the community of advocates, and talking about how you got the opinion from this expert who said, "Hey, trust me, I know what I'm doing because I'm the expert because I said so," and you weren't comfortable with that. And then you went to the academic medical center that was about 2 hours away, and the fellows basically told you the same thing. And then the attending physician came in, right? The chair.
Things changed.
Yeah. So tell us about that if you could.
So there were these two residents, and they were acting like they already knew what was going to happen with my surgery. So I was supposed to get less invasive. I was looking into getting a less invasive surgery that wouldn't require as much recovery time.
Right.
And when we got there, they treated it like I was going to get the more invasive, more recovery, more painful ouch one. And I was very overwhelmed because I thought it was going to be a repeat of a prior doctor. And when the big doctor expert came in, I told him,
he asked, do you have any questions? And you had the entire list of questions. And
that's a lot. But I was like, I need to advocate for myself now because there's going to be points in time where I'm in too much pain. And I need to know that I can trust you as a physician and a doctor, as a team, for my best care, because it's going to, whatever happens is going to impact me for the rest of my life. And I need you to be a good doctor, basically, and answer all my questions and
for myself because I might be in too much pain on another day. But then she goes and tells this doctor, you do this every day. All of this is a first for me.
Nicely done. Nicely done.
That is an outstanding
the entire
statement.
room changed.
Yeah.
I was suddenly very important.
So I want to just show, hopefully I can work this out, Scott. I want to share the video of the surgery that you wanted them to consider you for. And it's called the tether approach, right?
Yeah, that's correct.
So hopefully you can see this.
Oh, we can. It's loading.
Okay, terrific. So this is this diagram, this animation actually looks very much like the thoracic scoliosis that you demonstrated on the X-ray that I was able to share with the audience. And here's how the less invasive surgery is done. And it's still a very invasive case, but it's done through smaller incisions and doesn't require the weeks and weeks and weeks of missing school and not being able to bathe yourself, etc. So these screws are actually put into the body of the spinal of each of the vertebrae, and then this tether is affixed to it. And again, these are all done through small incisions, as opposed to spinal fusion is done through much bigger incisions. And then as that tether is tightened, it straightens up the spinal cord. Did I summarize it fairly?
It actually reminds me of
Yeah,
braces.
that was a perfect summarization.
And then it will continue to straighten it over time. So it's supposed to be easier on the spine itself,
Mm-hmm.
as opposed to one big jolt to your system. You know, they go for the main amount that they want to get, the curve straightened, and then over the next few months, it will continue to straighten out.
Awesome. So Scott, what do you think of this 15-year-old advocate that you're meeting today?
I mean, I was clapping earlier just with she had things written down. She knew what she didn't want. She learned how to speak the language of the doctor. She said, you guys do this every day. I want to stand up and do the wave for her. I think it's fantastic what you did. I think what she also ran into is very much common, is that these young doctors treat the textbook and not the patient.
Yeah.
And that's a real problem.
And Scott, I'm going to have to translate that for Annie and Denisia, because I don't think that they can hear us, or hear you rather. But what Dr. Richards says was, Annie, you had things written down. You knew what you wanted. You articulated that. And I will add that you did it in a way that was not confrontational,
yes,
but more collaborative.
I tried to be as respectful as I could.
Well, it sounds like you had difficulty, and it sounds like you had difficulty being respectful to the first surgeon, but glad you took a deep breath and you were respectful with the doctor at the referral hospital.
And I still can't thank you enough, because I did. I sent you that nervous mother message.
Yeah.
know someone is good, and then here's Annie listening the whole time to not just well, I need to rephrase that. She's been listening to the show about advocating for yourself.
Yeah. Well, you know,
oh no, go ahead.
But you know, to something that Dr. Richards had said earlier when you guys were trying to figure out the connection issues, you know, he basically said, trust your gut, right? Your heart and your head work together to really tell you where you feel you need to be. And I frequently tell family members and friends that, and Scott, feel free to disagree with me here, but I believe that one of the most important things about your relationship with your surgeon or your treating physician, they may not be who I would choose, but if you have confidence that you are in the right place with the right people, that matters as much as anything going forward.
Yes.
I can't agree. I can't agree more, Joe. I mean,
Right, Annie? Mm-hmm.
some of the literature.
Hold on. Go ahead. Finish, Scott.
I was going to say, some of the stuff that we're seeing in literature is if you're less anxious and you feel more comfortable, you're not going to have the chemical changes in your body that cause inflammation, and you'll heal quicker. So there's a lot to be said for being relaxed with your providers and feeling comfortable. And the word safe is so important in medicine. If you can feel safe, you're going to get better. Or at least better
so
chances.
Annie and Denisia, what Dr. Richards is saying is that if you feel safe and you feel confident with your care team, there is a biological impact that has, and just the neurotransmitters help you heal more effectively and more quickly. So having that confidence in your care team makes a huge difference. And Annie, I know that you haven't gone for your surgery yet, but at least you have identified a team that you trust, and that means the world. And Denisia, what I want to thank you for is, number one, for having enough confidence that I didn't steer you wrong. Thank you. But to also have the mother's tenacity to follow through on it. And I know it was a long way from home, and I know you had to take off from work to do it, but this is a big deal surgery, and getting to that right care team makes all the difference in the world. And you gave your daughter a gift that day that I don't know if she appreciates it today, but she will as she gets older, and especially as she gets to be a mom and is in a similar situation. But you followed through, and you didn't just accept the answer that the expert was telling you, right? You may end up doing exactly that, but you've explored the options, and now you have confidence that you're going to end up on the right path.
Agreed. Agreed. And the other doctor, we never felt good about. She never spoke to Annie.
Yeah.
She would speak directly when we had questions. She would say, "Oh, where did you get your medical degree?" Or, Or I think best or only. There's a slight difference between those two.
You know, Annie, I don't know if you saw Dr. Richards' response when you said, when did you get your medical degree? But he shook his head side to side. He's covering his face now. So you can see how we both feel about that kind of an attitude.
When everything was working, yes, you can hear us, right?
Yes.
Okay, because we lost screen.
Yeah.
But when everything was actually working for us, and you two were talking in the beginning, Annie said, she wrote down a note and she wants me to ask.
I can still hear them, guys.
Okay.
Go ahead.
How much does a frat boy that does pseudoscience make a year?
I like Annie a lot now. That is outstanding.
Oh my God. I think I've never seen Dr. Richards with more shades of red on his face than I see right now.
Oh my. I'm never going to forget this episode now.
Oh my God, that's great. That is great.
Thank you for the laugh, Annie. That is much appreciated.
Scott is saying thank you for the laughs. So funny. Hey, well, listen, Annie and Denisia, with all the difficulties that we're having, I'm gonna cut our conversation short today. But I am so glad that I had the opportunity to share your story with the hundreds of advocates that are tuned in right now. And I just can't say enough about. I think, Annie, you're a great role model. If a 14, now 15-year-old young lady can advocate for herself, then you're never too young and you're never too old, right?
Agreed. I'm incredibly grateful to have been given this platform, and I hope that this helps give many other people the courage to speak up for their health.
Annie, you're a remarkable young lady, and I look forward to continuing our conversations when we have a better technology working, okay?
Everything will work out soon, I promise.
Outstanding. Thanks very much for being with us tonight.
Thank you.
All right.
Have a lovely day, everyone.
Thank you. Take care. Annie and Denisia, folks. I'll tell you what, she's pretty special, isn't she, Scott?
That was absolutely wonderful to see. And I was going to bring it up, but you said it. Not only is she advocating for herself, but her friends, her colleagues, and people she will know in the future. She is going to be a role model. Yeah. She is going to be an example like Maya Kowalski is to many people around the world now.
It's interesting because I had never met Maya until the day that I testified. And it just so happened, pure coincidence, in that parking lot that probably accommodates 100 cars. I happened to park right next to Jack. And I had never spoken with Jack. I had never spoken with Maya. I knew a lot about them because I knew a lot about their tragic case and story. But I took the opportunity to talk with Jack briefly. And I just said, watching Maya testify, she was strong, she was poised, and she was tenacious. And watching her testify, I feel like I got a glimpse of who Beata was. And
amen.
I know that registered with Jack. You could see it caught him off guard, but he wholeheartedly agreed, because Maya learned that from her mom. She inherited that from her mom.
Well,
and I think Annie is cut from the same cloth.
I have to 100% agree. I was very impressed with Annie tonight, and the story that you've told. Obviously, for those out there who don't know, that's a very painful illness. My father was an orthopedic surgeon, and I had a lot of people when I would take out the cast and thing in his office. I'd watch these people come in. I'm very aware of the pain that goes on with scoliosis, short and long term. So she is an amazing young woman. Fantastic.
Yeah. Well, I do hope to have her on from time to time as she progresses through this and just hearing more about the story. But, I wanted to bring her on as much for anything, Scott, as to, I think that as we think about speaking up, there's risk in that, right? And
Absolute risk.
in order to advocate, you have to speak up. And I think it's human nature to generally avoid conflict. And you said it earlier that advocating almost by definition means that there is a conflict. And it's really, you referenced it in our conversations earlier, it's conflict resolution, right? But if we can pivot from using the tools that you identified, speaking the same language and finding that common ground, if we can pivot from a conflict to collaboration, we can really move towards a much healthy, a much healthier environment and hopefully a healthier outcome.
One of the things that struck me about Annie just in the few minutes, and I think back to Maya, and I use this a lot in my practice for 35 years. The three things that help us feel better, but the three things we avoid in life are structure, boundary, and consistency. Most of us, structure, we think it's confining, but structure lets you know where your limitations are.
Yeah.
You need to maintain a boundary around it. And that's where advocacy comes in, because people want to violate your structure. And then you got to do it every single day, day in and day out. And if you're consistent, people will listen to you. But if you're all over the place, so it kind of feeds into what I said earlier.
Yeah.
In life in general, it can be in sports. If you're structured and you have boundaries and consistency, you're going to achieve. In school, if you have structure and boundary and consistency. And you can decide for yourself how much boundary and how much structure. But if you don't have any of it, it's hard to advocate for anything.
Scott, it's interesting because what you just described sounds very much like much more finessed and sophisticated model of how I view parenting. And I always said that as a dad, my job is to put up the fence, and the kids are in the fence. And as they get older, their job is to push against that fence to increase the perimeter, right? And my job is to find the right time to move the walls out and give them more latitude. Yeah.
Wonderful. I love the analogy, that metaphor. That's exactly the way it works. I talk about when you build a house, you first put a structure, you put a foundation. And when you built the house, you got to have a door on it. So you got to have some boundary. And then if you don't clean it every day, it's going to get dirty. So, I have my boat. I do the same thing. I'm very structured with my boat. I have boundaries around it, and I'm consistent about cleaning it whenever we get back. The old phrase, if you take care of your equipment, one day your equipment will take care of you.
There you go. Well, Scott, I am eagerly awaiting the opportunity to get out on that boat with you and to go pull some fish out. And I'm going to start winding things down here, but Scott, I cannot say thanks enough for the insights that you shared. If I may keep you a couple more minutes just to answer some questions that we haven't gotten to.
I'd be honored to. And I want to thank you for this opportunity tonight. As I mentioned, I've stayed very low key since the trial, but I am honored to be part of this, and have watched some of the other people's shows plus yours, and I think the service they provide on these channels is fantastic. So I want to thank everyone involved that got Dr. Joe involved in this. And hopefully, if we did okay, maybe I'll come back in the future if you still want me.
Well, I know I'm counting on your commitment to come back so we can dive in a little bit deeper, but I think the conversation has been fantastic. One of the things that Ruby, and thank you for the super chat, Ruby, Dr. Richards, please talk about the problem of difficult organic diagnoses being punted to psych and the psych patient's physical complaints being attributed to psychiatric.
I don't think anybody could have asked me a more perfect question for what I deal with on a daily basis as an inpatient psychiatrist who does consults when I do my locum work. I have had so many internists and primary care doctors angry at me that when I get them on the psych unit, I order medical tests and I find out They have a thyroid problem. They've got a carcinoma somewhere. Their potassiums are off. And once we repair that, they get better. So what I tend to see is in terms of organic diagnosis, if we're saying organic in terms of dementias, that's a different ballgame. But medical illnesses, many times when they get severe, can manifest with psychiatric symptoms. I preach to young students and residents, symptoms do not equal illness. And that's the problem that happens when organic patients get punted to psych. They see a symptom. Oh, the person's hallucinating. And I would call and say, are they having auditory or visual? Because 90% of the time, visual hallucinations are caused by an organic or a chemical or a tumor.
Really?
And they say, oh, they're seeing things. I said, you know what? Let's get some labs first before they come to psych. So those are the simple things that I look at. The other phrase would be all that hallucinates is not schizophrenia. Everybody thinks the minute you hallucinate, you can have alcoholic hallucinosis. You can have all different types. If you have a brain tumor, it can cause hallucination. So you want to make sure that you're getting the right diagnosis. The second part of the question, physical complaints being attributed to psychiatry, is probably I look at one of the next areas of the integration of psychiatry and medicine, because now we're finding that people that hurt, if you treat their anxiety and frustration, the pain gets better. Yeah. And so we're talking about, in a sense, that the old term holistic medicine. Mm-hmm. I said earlier, you treat the patient, not the textbook. Now I've had to say to people, treat the patient, not the computer. and I tend to see also, too, in hospitals, a lot of polypharmacy. And so you start medicating something, then you treat a side effect, and now you've got 12 medicines on board. And actually, what Greg Anderson says about me, he says, whenever I have a question about somebody who's on medications, he sends it to me because he said, you know how these interactions. And I do think psychiatrists are becoming really good at that aspect. I lament that young psychiatrists are not being trained in psychotherapy. They're kind of becoming neuron mechanics is the term that I use. They're using the meds. Yeah. You have to remember that sometimes just talking to somebody and holding their hand makes them feel better. Yeah.
Yeah. And I know that you're not a big fan of telemedicine, and that's a part of it.
I'm getting a little more warmed up to it. My last job when I was in Myrtle Beach, I had to do some telemedicine because the psych unit was 10 miles from the medical center. So some of the consults we were doing via telemedicine. I don't think it's the best medicine, but if it's the only thing you have in your region, it's better than nothing. I don't like that I can't see the person from here down. I can't see them walking. I can't see the foot bouncing while they're talking to me. If you see someone's gait being abnormal, you might think of certain medical illnesses. So I think there are certain things you can lose. The one thing I do like in mental health is many times you will have a mental health worker, at least on the other side with you, and they can give you some feedback. So I do think telemedicine may get better as we get more down the road, but I still think the interpersonal, the sense of feeling the anxiety in a room. If you walk into a room and someone's pacing, you begin to feel anxious yourself. And I was trained, listen to your own emotions as a physician, find out if it's your own stuff. If it's not, it must be coming from the other side of the room. And if you can be aware of that, if the person's edgy, anxious, sad, depressed, if you start feeling emotions and you don't have any reason to feel that way, it's probably coming from the person. And if you can feel it, they're feeling it 100-fold.
And, Scott, a lot of what you say translates even to a broader platform, and that is simply how we communicate with one another. Harvard famously studied how much of what we hear from a communicating partner relies on words, and it's about 7%. And so the other 93% is eye contact. It's volume, it's inflection, it's body movement. Are you sitting there with your arms crossed, or are you sitting there with your palms up? All of this helps us add context to the words that are being used. And that's the danger of relying on text messaging, emails, even written notes. And so, I completely understand what you're saying. If you miss the tapping foot, that's a key clue to what that patient is feeling at the moment and how that impacts what they're trying to convey to you.
I couldn't agree more. I've used the kind of joke and saying, if you just read something, you're going to take it a different way. If I read person number 1 smacks person in shoulder and says, "You're an asshole." Well, that sounds very aggressive, but if they've been friends for 50 years and he's going, "Oh man, you're an asshole," it's a term of love. I love you. You're my friend. I care about you. The term we use in psychiatry is content versus process.
Yeah.
And the content is what you say, and the process is how are you saying it. So it's very powerful, and it goes back to what we started this whole conversation with an hour and a half ago. What we saw in the courtroom, the way Greg's team said things and the way they presented it was smooth. It was soft. It was comfortable. The way that the plaintiff, it was
defendants
hard, rough, and it was accusatory, and it was very negative. I mean, I say my own testimony, some of the things they were trying to trap me into. I like one time where he said something about, Ethan said, "You said this." I said, "No, actually, I would never say that." And I said, I want to go back. I've never seen the hour and a half that they argued about not letting me in on the testimony. I still have not seen that yet. Someday when I'm finally not having PTSD from 5.5 years of the trial, I'm going to go back and watch that, because Greg had said to me that it was quite an interesting hour and a half. I was sitting in like this, wondering why I wasn't testifying.
Yeah. No, it is interesting. I have watched it, and I went back and watched the debate about, they had a similar fight trying to keep me off of the stand.
Exactly.
Yeah. So it's, there is a lot to be learned in the rest of the 31 days, I think, the court was active. So I just want to point out that this is a message from Paul, juror number 1, and it's directed to juror 17. Greetings and salutations, but I would bet that Paul would be saying the same to you as well. So I don't know if you saw my conversation with Paul.
I did not.
There's so much more to him than just juror number 1. They really kind of, I don't think they did his personality justice.
Let me share with you, I did watch the process of Judge Carroll interviewing him. I watched that live. I made a point of being available for that. I was actually thinking about going over to be in court, and I decided to stay over here in my area of the state and not drive over. I want to say to Paul, if he's watching, I think you did an absolutely fantastic job in the accusations and the absurdity of what was said against you. Someday, Paul, if you're amenable, I'd love to, if I go over to Sarasota area, maybe talk with you about your experience, because I watched you a lot. I had a very good angle many times to watch your behavior, and I found you a very positive juror. And I was just very, very impressed with your demeanor and your ability to hold your own in a situation that, to me, should have never happened to you.
Yeah, I couldn't agree more with you. And not only did Paul do a great job during the interview on the 3rd of January, he and all 12 jurors plus alternates did a phenomenal job following the evidence and following the conversations, the debates, the argument, counter argument that is inherent in this kind of a trial. And and I've said it before, I think that Judge Carroll recognizes what a terrific job they did. And I think that several of his motions, or I guess orders, come from a judge, are they're just big love letters to the jury. He knows they had a very complex and complicated job, but they did it.
Took 8 to 9 weeks out of their life. This was a marathon for them.
For sure.
And watching it, the pace which Greg and his team ran this marathon was a very different pace than Howard and team ran this marathon.
Yeah.
I say that one thing I will say, I swam the English Channel, so I've trained for swimming marathons. No wetsuit. I've done around New York City. And when you train for a marathon, you don't think about the end. You're having to swim from feed to feed. And I watched this, and I felt that the defense was not looking at this as a marathon. They were trying to hit every single wave versus saying, I got 26 miles to go. I need to pace myself. And I think the jury did a fantastic job pacing themselves throughout
Yeah.
8 to 9 weeks of this that went on
Intensity
throughout the
too.
trial.
Yeah. Yeah.
I liked the fact that there was some levity about the football scores. I liked the fact that Judge Carroll did joke and laugh with them. And I think the relationship that he had with the jury was a very special one.
Yeah. Yeah. But I also think that he appreciated the fact that, you know, they all stayed on. You know, we lost one alternate on, I think, the last day because of a medical dental challenge. But, you know, it truly was a marathon. And, you know, since you brought it up, I think it's fascinating. You have swum the English Channel.
Mm-hmm.
You have swum around Manhattan Island.
Yep.
You have made the swim from the shore of LA to Catalina Island.
Actually, you start at Catalina and you go back to Palos Verdes.
I would never even consider trying it. I would struggle in a boat, sir.
You can't use a wetsuit either. That's the biggest part.
Really?
The thing that I'm the most proud of, though, I knew that I could do it. My older brother, actually, after I did all three, asked me, do you think I could? It took him a number of years, but I've got such pride in my brother doing it. We're the only siblings in history to do the Triple Crown. And I'm
no
really
way. Oh, my gosh.
Yeah, I'm just so proud of him for doing it. He said he'd never get in cold water, and he did it. He's coming to visit next week, so he'll probably give me a hard time that I mentioned him here on TV.
Have you ever considered the Alcatraz swim?
I've done Alcatraz before. That's not even worth getting in the water for. It's so short. What? You're in and out. I'm used to doing the 10, 12-hour swims.
But they've got the big sharks in that bay.
Most shark attacks happen in 3 feet of water.
Well, that's because that's where most people stand. Come on.
Actually, I trained in La Jolla Cove where I was living at the time, and we swim with the sharks pretty regularly.
Wow.
They just had a killer whale sighting in La Jolla Cove, which has never happened. And another friend sent me a little text, and I said, that's probably the one time I wouldn't have gone in the water that day.
Yeah.
It actually zoomed one of my friends out there. And
oh, my goodness.
It was her birthday as well.
Can I tell you that I would consider getting in the water. I would not spend 10 or 12 hours in it. My wife wouldn't spend 10 or 12 seconds if she thought there was a shark within 300 miles.
Well, I'll tell you, the interesting part of the Catalina swim is you start at midnight and the first 6 hours are in the dark.
No.
And it's one of the most amazing experiences I ever had. Towards the end of it, you get the phytoplankton, and the dark was there, and everything was lighting up green, and it was a very surreal experience. My son was on the boat while I was doing it. He was 11 years old, and he had said it was one of the best experiences. Actually, his comment was, "Dad, you taught me how to set a goal, work hard for it, and achieve it." And I think as a parent, I'm not sure you could ever say anything to your child ever. That's why I say your behavior is what tends to people see. People will listen to you, but when you do something, that means you're walking the talk.
Chief, that is major Father of the Year points right there.
That was a fun one. I got injured a few years ago, and I'm all healthy finally now. I've actually dropped a lot of weight since I saw you, and I'm hoping to swim Spain to Africa in 2025. That's a short one. That's only 10 miles, so that's a short one.
I will happily be on the boat as you go through the Gibraltar Straits.
I'll see you and Greg on that one. Yeah.
There you go. There you go. Hey, I just want to point out that LA, thank you for posting this, how to find the documents from the clerk of court docket. The instructions are here. If you need them, just email me, Gothic Brina. Maybe we can post those on the pin them on the chat if you would, please. And then I want you to see this, Scott, from Paul, Juror 1. Looks like he would love to meet. I happen to know a good breakfast and lunch place that Paul likes. So maybe I'll meet you there and join the conversation.
I should be over the area probably sometime in the springtime, so I'll keep in contact with you, Joe, and we'll see if we can set that up. Thank you, Paul. I would love to do that.
And I just want to say thanks to Nancy. It's a very kind note. Dr. Joe, you helped me during the teaching about advocating for myself to my heart doctor, and I did, and he looked at me and said, "You're right. You don't need a stress test." Being my other tests came back good. So, Nancy, great job. And thanks for not just talking the talk, but walking the walk. Well done. Congratulations to you. So, Scott, this is what I think is so great about this community is, everyone here is committed to the concept that, you've not met Patty yet, but, her family is from Greece. And when the young men finished military training and they were considered men and citizens of the great city-state of Athens, they would take a creed. They would recite a creed that included the phrase, we promise to leave this city-state not as beautiful, but more beautiful than it was given to us. And that's really one of the central themes that this community has committed itself to. We are learning to advocate for ourselves and for others, and we are dedicated to making things better. And Scott, I cannot tell you how much you helped advance our agenda by being here tonight, and I'm excited to have you back.
I thank you for the compliment. I'm humbled by it, and I would be honored to come back. And the community is fantastic. I try to catch it when I can in the evenings, different shows. You mentioned Megan. I've got to say, Megan Fox is the one that during the trial, I told Greg, you have to watch Megan Fox. He said, who is Megan Fox? I said, if you haven't seen her. And so I began to show him some of the stuff. And I don't think I'd heard him laugh during the trial. And it was nice to see him giggle a little bit during the trial. I think I'm going to get my friend back here soon once the appeals are over, because this has been so hard on him. And he has done a Herculean effort through this in time, money, cost to himself. He's his family. He's got kids that just adore him, and he finally gets to spend some time with them. So I'm so happy that he's back with his family now and not having to deal with Howard Hunter every single day. Still has to do something,
but as I said to Greg earlier today, you and I, more than he can feel more than confident that you and I both understand this is not the 15th round of a fight. We've got a long way to go until this is finished. And when it is finished, I think I would love to do that roundtable that you talked about and really get everybody together and dissect what really took place here.
Let me add one thing that we did bring up Monday. I think I texted it to you and for your audience, because Jules had asked you how I can't believe people are doing this. And my comment to you yesterday was, I actually believe everything because of my 2 standard deviation rule. And I'll say it again, expect the worst. And then what you can, if you're a good person, if you're somebody that has morals, values, and ethics, you can't imagine what somebody else would do. So drop it 2 standard deviations below and you'll be prepared. You won't be shocked. And I think I told Maya actually a couple nights, I think before they did the magazine thing at the New York Post. And I said, drop 2 standard deviations. So Greg uses that a lot, and I give him absolute liberty to use my standard. But it goes for life. If you go somewhere and you expect things to be perfect on your airplane, things never go right on the airlines. So prepare. The Air Force taught me prepare for the worst and hope for the best. No, the 2 standard deviations say prepare for the absolute unbelievable, and then you'll be prepared at that point. So that's part of advocating is prepare yourself for things you can't be ready for.
There you go. Scott, you are. I'm sorry?
It happens in the ocean too.
I will leave that for you to experience. I will be on the boat, preferably with a cocktail in hand. Actually, I don't know if this is my wife's or my daughter's, but the inscription on my big sippy cup is, "This is probably Tito's." I'm guessing it's my college-age daughters.
Thank you again for this opportunity. You're obviously a very caring, and I think the day we met, it was obvious that both of us have compassion. And as I said to you yesterday, I didn't go to medicine to get people happy. I got to help decrease suffering, because we all suffer. But if we can make suffering manageable, then we can live our lives.
Amen. Amen. Well said. And I can't top that. But I will. All I will say, Scott, is thank you. You're an amazing guest, and I can't wait to have you back on.
God bless everybody, and thank you. Appreciate the time.
All right. Dr. Scott Richards, thank you so much. Advocates, I know we ran a little long today, but oh my goodness, Scott is so smart and so compassionate. And just has a great perspective about it. And what's actually really super cool about him is he is a remarkably humble fellow who has accomplished so much in his life. I mean, think about just his swimming accomplishments alone, right? But he's also an expert fisherman, and he just has this diversity of skills that I just love the complexity that he excels in. And so obviously easy to have a conversation with him, somebody that's easy to trust, and being in psychiatry, and probably also because of his personality, a real student of the human experience. And so I know that when I have conversations with Scott, I learn. And I hope that you learn tonight too. I believe that I have gone through every super chat. I do apologize that I was not able to follow more comments and take more questions from the general audience. But Scott and I come from very similar households that we can both talk, and so he can give very long answers. Greg Anderson can give very long answers. I can certainly give very long answers. So I knew that our conversation was going to have to be kind of structured. I kept an eye on the clock as best as I could, and I still ran long. And then I wanted to make sure that we had enough time for Annie and Denisia, her mom Denisia. And I'm sorry that you weren't able to see more of her. More of them. They're just such a nice family. And again, 14, 15 years old, owning the situation, and you talk about a hierarchy. Here's an older physician who is medical school graduate, residency trained, fellowship trained, teaching at both her first opinion and second opinion both came from academic medical centers that I guarantee you 90% of the American audience would go, oh yeah, I know where that is, right? And probably half of the international audience would have heard of these places, right? So it wasn't like she was talking to a peer at school, right? But she owned it, and she spoke up, and she did it respectfully. She knew what she wanted. She wrote down notes so that she stayed on message. And she may end up doing exactly what the doctor who gave the first opinion recommended. That may, in fact, end up being the right thing to do. But now she can have the surgery done at a highly regarded academic medical center with a highly regarded surgeon who happens to be the chair of the department and specializes in this kind of surgery. And it does these surgeries every single week. And she has confidence, right? And that confidence, if you know that you're in the right place, as Dr. Richards says, that creates a positive environment inside the neurochemistry of your brain and your body that creates faster and better healing. So listen, she spoke up. She may end up with the same procedure, but she will end up in a better place, bottom line. And so if she can do it, all of us can do it. That's the message. I will bring Dr. Richards back. I will try to bring Annie and Denisia back as they continue through this. And you know what? Maybe we'll talk to Nancy D about her conversations with her cardiologist, right? I love hearing success stories of this community being effective advocates, because that's one of the goals that we committed to early on. I'm so proud of this group. I'm proud to be here with you. I'm happy to be bringing you great leaders like Scott Richards. And great examples like Denisia and Annie. Folks, I will be back here on Monday. I just found out about 2 hours before we started that my guest for Monday is going to have to reschedule, but I think I've got somebody really terrific lined up. And in fact, you met him before, Fred Nice. Many of you have asked me both in the chats and in comments and messages and in emails, you wanted to hear more of what he had to talk about. He actually wrote a chapter in the American College of Emergency Physicians textbook about advocacy. And so I asked him if he could join us. He's not available Monday, but we may try to record something. We'll figure it out. But I want to bring Fred back to continue the conversation about advocacy. I want to bring Dr. Richards back to talk more about not just advocacy, but also get into some of the other topics about the trial and the kind of the big overarching themes from the trial that we weren't able to get to tonight. But for now, I'm going to let you guys go enjoy your dinner, get to bed. Sally, go to bed. It's late in the UK, but God bless you. Thank you for making this really so much easier on me tonight. I really am grateful. Thank you to Gothic Brina. Thank you to Jules. Thank you to I don't know who else is moderating tonight, but and thank you to all of you who have contributed to the conversation. Nancy D, you're very, very kind. I'm glad you're here so often with us. Thank you to Scott from Recovery Addict for sending some addicts over from his gallery. Thank you for Megan Fox for joining us tonight. And always great to have two of my favorite jurors here as well. So don't forget, take care of yourselves so that we can take care of others. Good night, folks. Thank you so much for joining us. Take care. Sal.
I will tell you without hesitation, I will tell you that I did not have this anywhere in my 5-year plan, Mr. Anderson.
That much I believe. Yep.
Well, thank you, everyone. Make sure that you take care of yourself so that we can be taking care of others. I'll look forward to seeing you in the coming days. Again, Kurt, Jules, thank you so much for making this a very dynamic conversation today. I'm grateful for your help.
Oh, kill me now. Please tell me this guy's doing some fraud and there's going to be like an insurance investigator or something.
So, Fred, thank you so much for being a part of this. Thank you for sharing your insights and your experience, and can't wait to bring you back, my friend.
I'm looking forward to it. You won't have to try hard. This was a lot of fun. So thank you, everybody.
You hear that? I get the rest of the day off. Doctor's orders. That's what I hear.
I will write that prescription anytime for you, sir. And, this will not be our last conversation, especially if you can get me Samantha Lawrence on the show.
Okay. Well, maybe we'll see you before the hearing next week. But thank you for the honor of being your first guest, Joe. And
you bet.
All the kind words. Appreciate it.
Please, let's make sure that we take care of ourselves so that we can take care of others. Thank you so much.